will share our research, Invisible Users in Digital Health, a scoping review of digital innovations to promote physical activity among culturally and linguistically diverse people. So I co-authored this paper with Dr. Vincent Pai, Professor Burkhard Ritchie, Professor Donald Campbell, and Dr. Merkel. So I will talk more about the background and why we focus on this group. So as we know, digital health has strong potential for promoting physical activity, but those digital innovations often fail to sustain engagement among culturally and linguistically diverse women, or we call them CALD women. So in our paper, CALD refers to women from non-speaking backgrounds who identify with non-dominant cultural groups in host countries, while excluding indigenous persons who are not recent migrants. The reason we focus on this group because they are facing intersecting cultural, linguistic, social, and structural barriers. They are also experiencing disproportionately high risk of inactivity-related chronic disease and are often overlooked or excluded by default in digital health design. So for the prior research already make important contribution from two directions. So on the HCI side, prior review highlighted structural inequities in digital health and critique dominant design assumptions, but they still give very limited attention to specific vulnerable groups, context, and offer limited operational design guidance. And on the public health side, prior review focused more directly on CALD women and the dominant social cultural barriers. However, they also provide limited insights into the design mechanism that facilitate or hinder engagement. So to bridge this gap, we shift the lens from whether intervention work to how design mechanism can shape and sustain engagement. So to address this gap, we conducted a scoping review using the Prisma approach. We screened 1,938 records, reviewed 30 full papers, and finally including 18 studies in the synthesis. So within these 18 studies, evidence was mainly concentrated in United States, and there was also uneven cross groups. So 40 studies focused on Latino women, 3 studies focused on Korean American women, and only 1 each on Chinese American and multi-Asian women. So to guide this review, we also organized our analysis around 3 review questions. The first one is about what design paradigms currently dominate the development of digital creative intervention for CALD women, and what specific design shortcomings undermine their potential for sustained engagement. And third, how can HCI principle be applied to generate more culturally sustaining designs? So we found that in terms of the design paradigms, we found that there are 2 paradigms of culture tailoring. The dominant one is service level accommodation. So in this paradigm, culture is treated as access issue. Intervention focus on linguistic translation, interface simplification, channel localization. So these strategies can really improve the accessibility and initial uptake, but often address access rather than support long-term cultural engagement. The second paradigm is deep social cultural embedding. So this goes beyond access and began to integrate the intervention into the cultural fabric of user lives through cultural and emotional alignment, theory-guided adaptation, such as SCT, the social cognitive theory, and TTN, trans-theoretical model, and they also through the relational framing of meditation. So however, even the paper and the program, they adapted with deep cultural adaptation, but the cultural depth still remain the level of the content and demo instead of redesign the interaction feature or redesign the design features. So we further analyzing why service level is so struggle to sustain engagement for long term. So our finding identified 4 main tensions that constrain the engagement. So the first one is cultural and temporal misalignment. So one form of this is technology and conceptual mismatch. So for example, terms such as midlife women or depression, they may carry some stigma in some cultural context, and the concepts such as physical activity or the health may seem differently or understand very differently between the users and the researchers. And the tone or the content of the support may also not fit participants' daily expectation. For question 2 is about the scalability, attainment trade-off in delivery system. So as we know, the digital owning system is very easy to scale, but they are facing high attribution and with no ACE culture fit. For the digital intervention, they like support with in-person support or the remote support, They are very flexible and they are embedded in deep culture support, but they facing the resource intense issue and very struggle to scale. For Tencent 3 is the social support dilemma. So for the in-person support, they can build trust and the confidence easily at the beginning, but the engagement will often drop when that support ends. And for the add-on social feature, it's very common in some digital intervention. But for those add-on social features, they are only benefit for women who are already active. They fail to deliver their promising to help women who are in very low activity levels. Tencent 4 is about theory implementation gap in cultural context. So some paper, they cite theory, the SCT, the TTM, but they only cite without using those theory with cultural adaptation or didn't translate those theory into the design feature or interaction features. So those four tensions point out more broader paradox, the paradox of cultural design in digital health. So on the one side, the technical solutionist feature treat culture mainly as an access issue and overlook the relational and the temporal realities. On the other side, the add-on social features often assume that support network already exists, but often fail to engage in user with very low activity levels, especially for CALD. So to move beyond the paradox to more cultural consideration part, we propose the culturally embedded interaction framework. So it was developed through our synthesis of 18 empirical studies, and it includes 5 interconnect dimensions. The first one is culturally grounded measurements. So this means we encourage future research not only think about device-based metrics such as the steps or calories, but also including the culture and psychosocial indicators. For the dimension 2 is about the multimodal interaction. So this means providing multi-channel of support and accommodating different level of literacy and device access. For dimension 3 is about embedding social living. So instead of assuming they already have support, beyond general social feature and existing social ties, provide support into their trusted network or trusted communities. For the theory-guided cultural adaptation, so this means moving beyond citing theory and translating those theory into cultural adaptive interaction features. And in terms of the contextual and temporal adaptability, this means designing for changing life rhythms and supporting long-term engagement more flexible. So together, those five dimensions show how culture can be embedded directly into the interaction design to support long-term culturally sustaining engagement. And we further provide more actionable design implications for the future HCI research. So think about design for temporal fluidity, move beyond time-bounded intervention, and instead of we start to think about like using low burden or long-term scaffolding, and embedding behaviors change theory into interaction features. So move beyond citing theory as a conceptual justification, translate those concepts such as readiness, self-efficacy, and social reinforcements into culture-aligned interaction features, and rethink the role of social support. So move beyond assuming that support already exists, building support through trusted mediators and culturally appropriate pathway. And then think about design for cultural protection. Move beyond cultural generalization, co-design with specific gender or specific culture groups. So at the end, we want to highlight this review identified the important design paradox in the digital health intervention for CALD women. We found that the technical solutions feature ignore the social cultural context, while pro-social feature fail to support the women who are in low activity networks. So for our contribution, we propose the culturally embedded interaction framework and several design implications to help future researchers, move beyond one size fits all accessibility and toward long-term, equitable, and cultural resonant design. Yeah, that's all for our insights. And if you are interested, you can scan the QR code to read more detail about this research.